We're back, everyone, and before we continue the discussion, I just want to let you know that Dr. Becker's Bionutrients has a controlled release alpha-lipoic acid. It's fantastic. I know I take it. And for today, buy one, get one free so you can get the nutrient you need. Great way to get going on it. Buy one, get one free for today on that ALA. Now, Richard, I'm glad that you did the diabetic first.
Yeah.
Because back when we, and we go through the shows and the 6 things that every diabetic should do and all the different things, and they're so important, and ALA definitely is critical for the diabetic or the pre-diabetic.
Yes, it is. And the diabetic neuropathy, fully a third of diabetics have painful legs, hands, neuropathy as their first symptom and sign of the disease.
Right, that was my dad's, wasn't it?
Yes, exactly right.
Terrible
and
pain.
Every time I study lipoic acid, I think of your dad, and if I had only known about this, we could have helped him sooner, okay? And that's my concern for you. Folks, we're waiting too long to take action. We're waiting till the car's got 300,000 miles on it to change the oil. Well, you've done damage. We can't get that back. So don't wait too long. The pain in the legs, it's a glove or stocking-like pain. It's not like sciatica that's down one nerve. It's the whole foot and toes, and it's like a stocking covering. That's the neuropathy kind of pain. It burns, it tingles. And you go to the doctor, and you say, well, your blood sugar's fine, so it's not diabetes. Wrong. Wrong. You can have diabetes before the blood sugars show. They're not testing blood sugar throughout the day. You'll have times after that malted milk where your blood sugar shoots up, and obviously it's diabetic, but that's not being tested all the time. That's a glucose tolerance test. Anyway, the point remains. You may not know you have diabetes, but you have the pain of the neuropathy. 30% of those diagnosed with diabetes have that pain first. And alpha-lipoic acid provides relief. It is amazing. It's the most studied use of lipoic acid, provides quick reduction of burning, tingling, pain, and numbness. And animal studies suggest with time the nerve conduction parameters, the nerve conduction studies, also improve. What's this mean? Well, getting pain relief is one thing, and that's good. But if we can restore the health of the nerve, that's even better. And it appears lipoic acid does that, see? And animal studies are being conducted now to determine that. Some have suggested it does. Okay? So that's very important to regain nerve function along with reduction of pain and burning. University of Michigan researchers discovered lipoic acid improves pain associated with diabetic peripheral neuropathy, them and many others. This is not 1 or 2 studies, folks. These are many studies now. When we have a preponderance of evidence, we don't need to cite every study. There's 12, 15 studies that show that. Well, we don't need to cite every one anymore. Okay? There's a preponderance of evidence. A multi-centered study of 600 milligram and 1,200 milligram IV alpha-lipoic acid 5 times a week for just 3 weeks showed significant improvement in diabetic neuropathy for some 328 type 2 diabetics. Okay? And we know IV and PO create similar levels in the bloodstream. So you can do that at home on your own with an oral dose. That's powerful. A Chinese study, more than 73%, 3 out of 4 basically, of those suffering systemic neuropathy experienced relief on 1,800 milligrams. See, many of you are taking 300 milligram sustained relief a day, and you're going, I don't know if that's helping me. It's not enough. You have to take more, and it's safe to do that, okay? It's not a very expensive supplement. There's no medicine that does what this does. So bump that dose up. It's okay to do that. Here's one, the diabetic fatty liver, the retinopathy, the kidney disease, the nephropathy, okay? Long history of use in Germany to prevent fatty infiltration of the liver that leads to this non-alcoholic steatohepatitis, or the NASH, okay? It helps to prevent that. It also, I found a study, brand new study, just came in while I was doing the research. Lipoic acid prevents the fibrosis of cirrhosis. A healthy liver, we've all seen beef liver at the meat department, right? It's glistening, it's soft, it's almost jello-like, okay? Cirrhosis has a corn cob appearance, a cobblestone appearance. It's tough, it's hard, it's full of scar tissue that knots it up. Lipoic acid prevents that from happening. See, we need to get on these things quickly, early, at the first sign of dysfunction, not when we're blind, folks. Now, it's going to help even in extreme cases, but I want people to start thinking more holistic first, crisis management second. We can prevent the progression of these diseases in so many if we just started thinking that way. Wouldn't that be wonderful to do that? Multiple studies show improvement of both eye and kidney disease of diabetes, okay? To remember, we've learned in kidney disease of diabetes, there's huge oxidative stress, free radical stress in the kidney of the diabetes. That's what lipoic acid counters. See, that's exactly what you need. Reduces the loss of protein in the urine for the diabetic. That is huge. The albuminuria of diabetes is diminished. It also slows down the cataract formation in the eyes of diabetics. See, it's a profound antioxidant. Now let's do a little cardiovascular disease. You know, if we just had the diabetes and lipoic, I'd be thrilled. But there's more.
You know
Go
what,
ahead.
Richard, before we do the cardio, that was such a profound, I just love that section on diabetes.
Yeah, it's pretty
Let's
amazing.
tell the diabetic what levels they should take. Because
Well-
they're going to get a bottle and it's going to say 1 or 2 or whatever it is
Yes,
on there.
yes.
And I want them to get the amount that's really going to work because there are going to be people calling in today.
Okay. The 300 milligram a day is the minimum. That's the starter baby dose, training wheel dose.
Okay.
That would be for someone who is in really good health. They want to have a powerful antioxidant. Maybe there's diabetes in the family, and
Okay.
they're looking for a maintenance program, prevention. But if you have a diagnosis of diabetes, if you have neuropathy, pain down the legs, this type of thing, minimum dose is 600. I would start at 900 a day, morning, noon, and night. 300 milligrams morning, noon, and night. You'll get a better drug.
Okay.
I say drug level. Supplement level.
Right.
Lipoic acid level. Okay?
Wonderful.
So it's a little higher, but this is not a drug, remember. This is not a drug. It's in each and every one of us. Our body recognizes it not as a foreign invader, but part of us, so it accepts it. Okay? If there's too much in your system, it has a perfectly good way of just getting rid of whatever it doesn't need. Okay?
Good.
All right. Now, cardiovascular disease. We have evidence now, multiple evidence, that lipoic acid reduces cholesterol while preventing the oxidation of LDL cholesterol. That's the generation of a heart attack. It helps to prevent that phenomena. It increases cardiac output but while reducing blood pressure. That is phenomenal. Cardiac output, how much blood is going out to the periphery, but it doesn't do it by increasing the blood pressure. It makes it more efficient. See? Okay? This means that lipoic acid has merit for heart failure, for cardiomyopathy, for coronary artery disease, stent placement, all of these. You came close to the heart attack that got the stent in, you know, all these things. It will help oxygenate your tissues. It lessens the damage of a heart attack or stroke by decreasing reperfusion injury. Now let me explain that, reperfusion injury. If I take a little string, a thread, and tie it around my finger and cinch it tight, what's going to happen to that finger?
Ooh, you're going to cut off your blood supply.
Yeah, it would auto-amputate eventually. It'd take a few days, but eventually it would fall off, right? Well, let's say I put it on there for an hour and a half. Okay, the finger will look strange, but it's not inflamed while the tourniquet is on, right? But as soon as I take that tourniquet off and the blood goes into the finger, boy, the inflammation just goes crazy. It swells because the new blood coming into those damaged, ischemic, low oxygen tension tissues recognizes damage. And the white blood cells release all their cytokines and inflammatory products. This is the reperfusion injury. Now, you may say, well, I'm not tying tourniquets onto my body parts, Doc. What are you talking about? Well, this happens to us all the time, okay? One of the major mechanisms of losing brain power with age are tiny little blood clots that get caught in the tiny arterioles of the brain. When that little clot gets dissolved, the blood gets in there, you have a reperfusion injury. And it causes death of a tiny little section of your brain. Let's say you're bedridden and you're lying in the bed and you develop a pressure necrosis decubiti ulcer, a bed sore. Well, when you get the pressure on there, the damage is occurring. When the patient moves, that's the reperfusion injury. Diabetic foot ulcer, the same thing. The reperfusion injury is at the root of so much of the decay and degeneration associated with disease, and alpha-lipoic acid decreases that. That is remarkable. Reperfusion injury, alpha-lipoic acid, helps prevent that. We have a break. We'll have more on Alpha-Lipoic.